hip will get stuck in an internally rotated or an externally rotated position. In fact, you guys have done something like that with the shoulder in Dr. Becker's class, right? So, I'm just gonna lift this leg up, and if I bring the patient's leg up like this, and I move it this way, I'm concentrating down here on the acetabulum, and I'm moving everything in this direction. What is that moving, internal or external? It's moving internally. That's right. Okay. So this is, of course, what? External. Very good. Now, if in fact the patient's hip is locked at the acetabular joint and it's in an internally fixated position, you have an internal femur at the acetabulum, when you would go to your motion palpation, it would have a hard time moving into the external position relative to the normal side. Does that make sense? Yeah. So if our patient has an internal hip at the acetabulum and I find the restriction is going external, my adjustment is simply to increase that external rotation. Does that make sense? So that's, now we're going to have a couple of ways to do that. But before we do that, I'm just going to talk about the external. So if it's an externally rotated or an external femur at the acetabulum, it's going to not move internally as well as the other side. Has everybody got that? Okay, so then my adjustment would be to what? Increase the internal rotation. Has everybody got that? Okay, now there's a couple ways to do this. The second way is the best way, but the first way is the way you can do if the patient is smaller than you, and it can work very nicely. But so let's just say Megan's hip is in the internal rotated position. That means it's not going to move externally. So I've already examined this side. Okay, I got my range of motion. I can feel how this is moving, even though I'm not really feeling the joint. Although some people, when they're motioning it, they actually feel the joint when they're doing this, and that's fine. I kind of like to just sort of like to feel it through the bone this way. And I also like to look at the rotation of the foot. That sort of gives me an idea of how, if it's moving or if it's not. Has everybody got that? So you'll do your bilateral comparison. Then what I'm going to do, if it's internal, I'm going to increase my external rotation. You can just lay that like that. I'm going to go like this, and I'm going to get on the anterior part of the greater trochanter, take out all my slack, and I'm going to thrust this way. Does everybody see that? Okay, if it's external, then I'm going to move it into the internally rotated position, take out my slack, and thrust. Does everybody see that? Okay, now that's one way to do it. The other way, which I think is the better way, I'm going to have the patient, can you slide down here to the bottom of the table for us? There you go, that's good. You can lay back. No, I didn't say you can move back. I said lay back.
Oh.
Slide to the end. No, slide to the top. No, slide to the end. No, go ahead, slide.
Okay, now, I'm actually going to have you slide all the way down to the bottom of the table. One down. There you go. Thank you. So, if it's internally fixated, I need to increase what? The external rotation, correct? So I'm going to take the patient, I'm going to put the patient's leg on my medial shoulder. I'm going to take my fingertips and I'm going to grab onto the anterior part of the greater trochanter. And I'm going to move into this direction to start taking out this mechanism, see? And I'm going to grab on here, and I'm going to get a little bit friendly with this as I'm going to bring this around. My elbow has to be medial to my contact point, and I'm going to take out my slack and thrust. Does everybody see that? That works a lot better. You get more control of your patient. Now, let me do the other one for you folks over here. If it's external and I have to increase the internal rotation, again, I want to bring this up here to about 90 where you want this adjustment. Now I'm going to use the heel of my hand. I'm going to be on the posterior part of the greater trochanter. Here, get a little friendly with this hand. I'm going to take out my slack and I'm going to thrust this way. Okay, so everybody got that? So that's for an internal or an external femur acetabulum. So break up, try these moves.